Here we have the right and left magnetostrictive inserts. The first step is to identify which insert is the right and which insert is the left. The clinician will begin by holding the handles parallel to the floor and the tip of the inserts pointing towards the floor. The insert that is bowing to the right is the right insert, and the insert bowing to the left is the left insert. The primary use of the left and right insert is known as the vertical technique. The vertical technique is indicated for periodontally involved patients that present with pockets that are 4 millimeters or greater, areas with clinical attachment loss, and furcation involvement. The handle is roughly parallel to the occlusal plane. Remember that all sides of the magnetostrictive are active. However, when using the right and left inserts for the vertical technique, the clinician must ensure that the back of the insert is adapted to the tooth structure, specifically in furcations. This is because the back of the insert is the least active part. The tip of the insert is pointing towards the apex of the tooth like a probe. When considering the correct adaptation of each insert for the vertical technique, the same insert can be used on the opposite surface for the transverse technique. For example, here we are using the right insert on the lower right buccal surfaces for the vertical technique. With the same insert, we will use the right insert on the lower right lingual surfaces to achieve the transverse technique. Here we can see the clinician is using the right magnetostrictive insert in the transverse technique. The transverse technique is used interproximally, specifically the mesial and distal surfaces. The tip of the insert is pointing towards the midline of the tooth. With the transverse technique, the lateral surfaces of the right and left inserts are adapted to the tooth structure supragingivally.